one.
According to data from the CDC, between the years of 1999 to 2019, there were close to 900,000 drug overdose deaths in the US, with 70% of these being related to opioids, making opioids some of the most deadly drugs that there are. Today, my group is going to dive a little more in depth into the opioid crisis and what it really is. So, I'm going to introduce what opioids are and what some of the causes of the crisis are. After that, Logan's going to go a little more in depth and talk about how the opioid crisis has affected Indiana and Canoe County specifically. After that, Taylor's going to talk about what's already being done to address this issue. And then JT is going to tell us what our proposed solutions are to help out in our area. So to start off, what are opioids? So they're a class of drug, and they've actually been used for over 100 years to relieve pain. So there's a lot of different forms of opioids. They can either be natural opioids derived from the poppy plant, or they can be synthetic opioids that have been entirely produced in a lab. But the one thing that makes all of these drugs similar is that all of them have a very high potential for abuse and addiction. And one of the main reasons for this is that all opioids release chemicals such as dopamine and endorphins in the brain that cause the user to feel good, and it also reinforces the act of doing the drug. So, opioids have been around for a while, and even the drug heroin has been popular since the second half of the 20th century. So, why is there an opioid crisis right now specifically? Well, overdose deaths and addiction rates have been on the rise for the last 20 years. The overdose deaths in Indiana between the years of 2011 to 2019 tripled in their rate. And this change in deaths has occurred all across the country. We can see that. And it's really there's a lot of different reasons for why this is happening. So, some of the main causes of the overdose deaths getting worse in the recent years have been that opioids are very easy for users to overdose on, and they always kind of have been, especially when compared to other drugs that people do. But one of the main things that have changed has been that legal painkillers have become much more accessible for people. Pharmaceutical companies were pushing pain pills such as Oxycontin and Vicodin and just trying to kind of make money off of that and treating it like it wasn't really a big deal. And one of the things that really reinforced this was the pain clinics that began to pop up in the early 2000s. Now, these pain clinics are often referred to as pill mills because that's basically what they are. People can go in and very, very easily get a prescription for narcotic painkillers. But one of the really messed up things about these pill mills is that they also sell the medication at the same place, so they're making money off of it as well. So, according to a 2010 article I found written by Rigg, March, and NCRD, one of the clients of one of these pill mills estimated that the the clinic was pulling in between $20,000 to $30,000 a day by basically being legal drug dealers. So now that I've talked about some of the overall causes, I'm going to let Logan dive a little more in depth into what's happening in Indiana and Tippecanoe County specifically.
So to understand this problem at the large scale, we have to look at America first. And in 2017, through America, there were 47,000 overdose deaths just with opioid abuse. This is a big problem because it's obviously showing that people aren't getting the help that they need. People aren't able to go find a different solution to help kill the pain that they may be having. For example, if someone after a surgery is prescribed a strong painkiller, it's very easy for them to get addicted. And the help options currently aren't what they need to be to actually get those people away from the painkillers. So Indiana's overdose rate from 2016 to 2017 was the third highest in the nation, only behind New Jersey and Nebraska. So clearly Indiana has a bigger problem that's also not being addressed, and it's something that needs to be looked at. Slide. The opioid crisis on the small scale actually affects people in just our backyard here at Purdue. From March to October of last year, according to a survey done by the Purdue University, found that there were over 222 overdose runs for ambulances in that time period. This is an extremely high number. That means around 28 runs per month, which is almost one every day when it comes down to it. Which shows that this is not a problem that we can push under the rug and ignore. This is something that needs to be addressed quickly and efficiently. Slide. The opioid crisis has also been affected by the COVID-19 pandemic. The opioid abuse is not usually, excuse me, can sometimes be driven by depression and mental illness, not only by needing to get rid of pain. And the JAMA Network did a study during the pandemic and found that people suffering from depression and mental illness nearly tripled. So as you can see, with this tripling and people needing something to occupy themselves and help with whatever they may be dealing with, opioids seem like a easy Band-Aid fix in that situation. And now I'm going to give it to Taylor so she can talk about how this problem is being addressed.
So first and foremost, I must talk about the governmental factors of how this has been addressed throughout the country. First, let's talk about the Opioid Crisis Accountability Act of 2019, which was introduced around 2 years ago, in May 2019, sponsored by Bernie Sanders. This act would pretty much hold people accountable for their part in the opioid crisis. This bill would prohibit false advertisement to the addictive natures of opioids, prohibits knowingly supplying communities with opioids without medical use, and many other aspects are prohibited through this act. Secondly, let's talk about the state legislature limit on opioid prescriptions. Of course, this would mean that the less time you have the opioid, the less time that you would be able to get addicted to it. These limits started in 2016, which means that people will only have a certain days to have this opioid limiting addiction, as I said. These limits can range from 3 days to 14 days. And according to the National Conference of State Legislatures, Massachusetts was the first state to start this trend in early 2016, where many states started to follow. And according to the same group, by 2018, 33 states passed a law for some type of limit on opioids. Here in Indiana, our state limit is 7 days. Finally, let's look into CDC funding for the prevention of opioids. And if you don't know what the CDC is, it's the Center for Disease Control and Prevention. And according to a 2018 article by the group has funded a variety of states and organizations with millions of dollars to fight this epidemic, which is ultimately their job and which they're ultimately doing. This money is being used to enhance data to monitor the trends in the epidemic, strengthen state and local response to the epidemic, increase public awareness, and work with the people who actually have hands with the opioids, like doctors in the healthcare system, to prevent and reduce unsafe exposure to opioids. Now, this is, of course, the governmental factors, but really to understand it, we need to look at community factors. How are people actually being helped? And now I will be talking about the internal ways that the opioid crisis has been addressed. So first, let's go on a timeline. We're gonna go from a project in 2009 to a recent project in 2020 to a project that's happening right now to show that this problem is being solved currently, and it has been trying to be solved for over 10 years. First, let's look at Project Lazarus's project in North Carolina. Project Lazarus is a nonprofit organization which took an intervention in Wilkes County, North Carolina. In this county, pretty much, the county's poison mortality rate was quadruple the state's in 2009. So of course, this was a call to action. In the following years, this organization would try to reduce the number of deaths in the county by various methods. This would be by using rescue medication for reversal of overdose, community activation, following many other methods to success. And let's just say this organization was very successful in their efforts. In a 2011 article, The mortality rate was said to have gone down from 43 people per 100,000 to 29 people per 100,000. So as you can see, a lot changed. Continuing on, a study in 2020 by community healthcare health centers, it was pretty much an opioid relief program in California called the Bridge Program. And a late 2020 article by the community healthcare systems for around 18 months, which was around in 2019, these medical centers were providing people with help from cravings and withdrawal symptoms. Moreover, in this article, it is recognized that the overdose rate has increased since the pandemic, like Logan said, making this program even more useful. And according to a doctor on this study, Dr. Vora, a USC professor and medical director of California Poison Control, stated that he has helped over 400 people with their addiction so far. And this isn't many, but this is a start. Finally, let's look at something more recent, something that's happening right now. In Minnesota, they're using their funding to do better with the opioid crisis. In Minnesota, Blacks are 2 times more likely to overdose than whites. Also, American Indians in Minnesota are 6 times more likely to die of overdose than whites. Grants have been given to the state in hopes to reduce these numbers and prevent overdose altogether. This funding is being used to overlook various programs and activities to end in less overdose numbers and preventing overdose. As I said, and this project is happening right now between September 1st, 2019 and August 31st, 2022. So as you can see, projects have gotten to communities, but how does this relate to the greater West Lafayette area? Now I will be handing it off to JT so he can explain any type of help that can be implemented to the area right now.
Thank you. So first, we need to start with what we can do on campus when we handle this problem. We can offer alternative pain relief practices for students in public, because according to the Association of Anesthesiologists, there are many non-opioid treatments available for pain relief, including massages and acupuncture that are very effective. So if we offer free massages, open hot tubs, saunas, and CBD therapies, we can help reduce the pain for people so they don't have to rely on opioids. So what about safety on campus though? Well, slide please. There's a drug called naloxone that can help stop opioid overdose. So if we put this in every dorm hall, we could prevent deaths from opioid overdoses. It's easy to use. It's as easy to use as an EpiPen. And according to the National Institute of Drug Abuse, the Aviso method of injecting naloxone is a pre-filled auto-injecting device that you just inject to the outside of someone's thigh. It's low cost and it would save lives. Slide, please. In the greater Lafayette, we need to make a cultural change though. And this happens by being aware and understanding of those with this issue and make them feel comfortable to get help. We don't need the stigma about it. It can happen to anyone. Normal everyday people get addicted to these drugs, and we cannot blame those who are addicted. Speak your mind. Slide, please. But we also need to know how to protect ourselves by talking to your doctor about other ways to handle pain and plan full tapering of drugs to find help as soon as it becomes too difficult. Be educated. Slide, please. But the easiest way to make changes in the West Lafayette area is by making changes globally. We need to use government incentives and funding like they did with the COVID vaccine. According to the Department of Defense, the COVID vaccine was made in 14 months instead of 73 because they use this calculated action. If they use this calculated action to produce more drugs that would help with pain relief, we could help that aren't addictive, we could stop the drug overdose problem. According to the National Institute of Drug Abuse, a new experimental compound called AT121 is as effective as most opioids without the addiction. Slide, please. So what can we do to bring on these changes? Well, be an advocate for change and be understanding with people's struggles. Contact the administration here at Purdue and tell them these changes need to be made for the safety of the students and the greater community. Call your congressmen and women who just want to be reelected and tell them you will vote for them if they make these changes to help prevent the opioid crisis. Changes can be made at all levels of society, small to big. So I encourage you to take that small step and start bringing a change in stopping the opioid crisis. Thank you.